Alright, hello everyone. This is our video on allograft and alloderm. This is made by me, Elijah Relucio, Surya Siddiqui, Christian Garcia, and Stephanie Garvin. Next slide. So for our introduction, allograft. Gum surgery is more common than many people think. According to CDA, severe periodontal disease is 11% of the population worldwide, ranking it number 6 spot for disease and prevalence. In cases where there is severe gum loss due to periodontal disease and surgical treatment is mandatory, procedures like gum grafting may be needed. There are several options to treat gum recession. For cases where it's not too serious, scaling and root planning may be enough, but in those that need to rebuild the lost tissue, surgical techniques like flap surgery, guided tissue regeneration, and gum grafts is needed. Gum grafts can use tissue from the patient's mouth, which is called autograft, synthetic material, which is called alloplast, and our topic about today, donated human tissue, which is allograft. Next slide. So what is it? Like I said before, an allograft is a donated human tissue, and an alloderm is a modified donated human tissue. An alloderm is a type of allograft that has been modified to have all its cellular components removed, preserving its bioactive dermal matrix to prevent immunogenicity. It consists of collagen, elastin, blood vessel, channels, and bioactive proteins that support tissue remodeling and cell repopulation. Next slide.
So the clinical application. In the dental setting, alloderm is used when gingival recession is present. For clients who do not want to have the surgery done to use tissues from their own body, such as from their palate, this is a great alternative. Alloderm helps to cover roots to protect the client from getting root caries, as having an adequate amount of gingiva is imperative for control of plaque. It also helps with sensitivity for client comfort. So when you have that exposed root and you don't have the enamel covering, it helps with dentinal hypersensitivity. It can be used to create better conditions for restorative work, especially before placing an implant, and it also enhances soft tissue aesthetic around implants. And there's an image right there. And now we have a video on how it works.
Recession of the gum is a periodontal complaint characterized by the loss of gum tissue in the immediate environment of the tooth, resulting in a bearing of the root. These exposed areas can be in turn acutely sensitive, and they can create in certain places an anesthetic outline or even be the expression of a more acute attack. In these cases, it might be advisable to coat partially or completely the exposed areas of the dental root. Many techniques have been developed to correct gum loss, most of which proceed from graft of the mucous membrane. These samplings are obtained from the palatine membrane, creating by the same token a second surgical site, thus opening the door to complications linked to the second operation: bleeding, pain, tenderness, infection, loss of sensitivity, and many others. With the invention of allergenic materials of the alloderm type, it is now possible, when indicated, to recover and correct the exposed areas of the root without using sampling. Once the local anesthesia has been administered, a small incision is made so as to create an appropriate site for the alloderm graft. Alloderm is a matrix of cellular collagen widely used in general surgery. The total lack of cellular components makes it a safe material, thus eliminating the risk of inflammation or rejection. When prescribed, the use of alloderm allows, in many clinical situations, aesthetic results that are impressive, leaving little or no scars. It is affixed with interrupted stitching. The gum is then replaced so as to cover the material. Some precautions will be taken to reduce the risk of infection. Antibiotics such as chlorhexidine can also be prescribed in the days following the intervention. Whenever prescribed, the use of Alloderm allows, in several clinical situations, impressive aesthetic results, leaving little or no scars.
Advantages: no palliative donor is needed. Eliminates the need to harvest connective tissue from the patient's palate, which reducing the risk of complications. And limited tissue supply. All of them is available in different sizes and thickness, allowing the multiple sites to be treated at once. And it is useful for patients with such as general gum recession. Improvement in patient acceptance. All of them is biocompatible. It integrates well with the tissue of the client. And patient comfort. As the tissue isn't taken from the patient's palate, there is less surgical sites, meaning the procedure is faster and could be much simpler than a regular gum grafts taking gums from palate. And all of them has a great aesthetic results as the graft integrates well and blends with the surrounding tissue. There's often no scarring visible. Disadvantages. Disadvantages. All of them is an expensive treatment and it is more expensive than a traditional gum graft, as is a harvested from a patient's own palate, and less people are able to get them due to the expensive treatment. And it has a slow healing. All of them lacks the live-in salt, meaning the procedure relies on the client's respond and resulting out slower healing process compared to autographs which taken from a patient's own palate. Generally, all of them takes about nine months before you can actually the actual results starting from them, and it could varies or be longer than that. And there is a potential graft failure as blood supply is a great role in this procedures, and all of them does not have that much cells in the supply.
So, who is eligible? When selecting clients for alloderm procedures, case criteria play a critical role in ensuring success. First, this material is most appropriate for patients with more than 2 millimeters of gingival recession. These are the cases where soft tissue coverage can provide both functional protection of the root and aesthetic involvement. Second, we need to consider systemic health. Alloderm is best suited for patients who do not have autoimmune disorders, since these conditions may compromise healing and graft integration. Finally, the patient should be ideally a non-smoker. Smoking is one of the strongest risk factors for graft failure, delayed healing, and compromised aesthetic outcomes. By carefully choosing cases that meet these criteria, we can improve predictability, patient satisfaction, and long-term success of the procedure. Now, let's talk about the most important postoperative instructions for patients after an alloderm procedure. First, patients should be reminded not to pull on their lips or cheeks to check the surgical sites. These movements can disturb the graft and delay healing. Second, it is advised a liquid and soft diet during the first week. Um, Foods that are easy to chew and swallow will minimize the trauma to the surgical area. Along with this, it's important to avoid harmful foods such as anything crunchy, spicy, acidic, which could irritate the tissue. Next, emphasize the patient not to brush or floss in the surgical area within the first 24 hours. Instead, they can maintain cleanliness through gentle methods. One helpful measure is salt water rinses, which can reduce bacterial load, soothe discomfort, and promote healing. Finally, oral hygiene is critical. A professional oral hygiene intervention, such as localized supragingival scaling, may be required to control plaque in surrounding areas without disrupting the graft.
All right, so to conclude, alloderm is a tool that is used in a dental setting to complete reconstructive surgeries. Gum grafts are extremely beneficial to clients with exposed roots to prevent root caries and sensitivity. Alloderm has many advantages for patients that they can find very appealing, such as patient comfort and aesthetic results. As with any other surgery, however, there are also a variety of disadvantages of alloderm. It is a very expensive treatment, and it is always important to keep in mind that graft failure is a possibility. Alloderm is, overall, a type of allograft that can create a bright future for many clients and provide healthy smiles for those who undergo the surgery. Thank you, and these are our references. All right.